What up, wise guys? It's your wise girl Alicia, and today we're talking about sexually transmitted infections! Sexually transmitted infections, otherwise known as STIs, but you probably know them as STDs. The reason that I will be calling them STIs is just because it's more medically accurate to call them infections rather than diseases. Because infections are when a bacteria or a virus enter into the body, whereas a disease is when cells are damaged as a result of an infection. And so for this lesson, I'm going to be using the term STI. But before we get into the different kinds of STIs and what you need to know, let's go over some numbers. According to the CDC, there are 20 million new STI cases every year in the United States. Of those 20 million, half of them, so 10 million new cases every year, are among people aged 15 to 24. Now, there's a lot of people who might think that the reason young people are such a high-risk group for STIs is because they're the age group that is having the most sex or is the most sexually active. But really, 15 to 24-year-olds make up only a quarter of the sexually active population in the United States. So really, the older age groups are actually more sexually active than young people. So then why are young people an at-risk group when it comes to sexually transmitted infections? Well, there are many reasons why young people are an at-risk group, but one of the biggest reasons is a lack of general knowledge around STIs, as well as an understanding about prevention and treatment. But this video is here to help. We're going to go over all the basics that you need to know about each STI, what symptoms to look out for, how they're tested, and what treatment looks like. Let's get to it. The first thing to understand about STIs is that there's three main categories: bacterial, viral, and parasitical. These three categories are based on how the infection enters into the body. Let's look at the bacterial infections first. Bacterial STIs are chlamydia, gonorrhea, and syphilis. Let's talk about chlamydia and gonorrhea together, shall we?
Why?
Because these two infections have a lot of similarities, and they're the most common infections amongst young people. The important thing to remember about all STIs is that they are mostly asymptomatic. That means that someone with an STI doesn't have symptoms. And if someone doesn't have symptoms, they feel just fine, they feel perfectly healthy, and they will never know if they have an STI unless they get tested. So, to test for chlamydia and gonorrhea, they will either use a urine sample or a vaginal, anal, or oral swab. And if someone's test came back positive, then they get treated with a round of antibiotics. The great news about chlamydia and gonorrhea is that they are both completely curable. However, if these are left untreated, there can be some serious consequences, like abdominal or pelvic pain or even infertility. But fortunately, condoms work really well to prevent the spread of gonorrhea and chlamydia, because those bacteria are spread through vaginal, anal, or seminal fluids. The other bacterial STI is syphilis. Like most STIs, syphilis can be completely asymptomatic, so you won't know unless you get tested. To test for syphilis, a doctor will take a small blood sample. But the best thing about syphilis is that it's completely curable, with either a dose of penicillin or other antibiotics in case someone is allergic to penicillin. However, if left untreated, syphilis can have some very serious, even life-threatening consequences. If syphilis is left untreated, it can cause brain damage, nerve damage, or damage to the eyes, heart, blood vessels, liver, bones, and joints. And it's also important to note that condoms are not always effective at preventing the spread of syphilis because it can be spread by skin-on-skin contact. But the big thing to remember about all bacterial infections is that they are all curable, and you can get the bacteria out of the body. And even if they're not 100% effective, condoms are very good at preventing the spread of bacterial STIs. On to the next category.
Category is
Viral infections. This means that all of these infections are caused by a virus entering the body. It's also important to note that once these viruses enter the body, they will never leave. It will be something that someone will live with for the rest of their lives. But that does not mean that they can't live full, healthy, happy lives, because we have the information and technology to help people live comfortably, even if they're living with a virus. So you can kind of think about it like if someone's born with diabetes. They learn to manage it and live with it, and they can live normal, comfortable lives. But let's start with the only viral STI that has a preventative vaccine: human papillomavirus, also known as HPV. There are more than 100 strains of HPV out there. Some of these strains can cause warts on hands, feet, face, arms, legs, and even genitals. But most commonly, strains of HPV have been shown to cause cancer in the cervix. Fortunately, there is a vaccine available to help prevent the spread of the strains of HPV that are most likely to cause cervical cancers. And because HPV can be spread also through skin-on-skin contact, condoms can be effective, but they're not the most effective. And so the CDC recommends that everyone aged 11 to 12, or even as early as 9, to get the vaccine so as to be sure to get them vaccinated before any sexual contact. The next viral infection we'll look at today is herpes. Isn't it cute? It's got little eyeballs on it. Herpes is a super old infection. It's been around with humans since basically we've been humans. And because it's been around so long, it's like crazy common. In fact, the World Health Organization estimates that 3.7 billion people have type 1. And it's estimated that 491 million people have type 2. When we talk about type 1 and type 2 refers to oral herpes and type 2 refers to genital herpes. Both strains can be passed by skin-on-skin contact, like kissing, oral sex, anal sex, and vaginal sex. Condoms and dental dams can be great methods to help prevent the spread of herpes because it's a barrier between that skin-on-skin contact. It's important to note that those billions of people who have type 1 or oral herpes or get cold sores probably did not get them from sexual contact. In fact, most oral herpes infections happened in childhood because, you know, when you're little and you just keep putting things in your mouth because that's how you learn about the world, that's normally where those infections come from. Although a lot of people in the world have this virus, there's still a lot of stigma attached to it. But it's important to remember that herpes, really, it's just a skin condition. And it can be uncomfortable, but it doesn't have to have a severe impact on someone's life. And even though it will live in the body forever, herpes is super treatable and it's pretty predictable. There is a super effective medical regimen that allows people to suppress the virus, making outbreaks and transmission much less likely. And so the last type of viral infection we're going to talk about today is HIV/AIDS. HIV stands for Human Immunodeficiency Virus. Well, what does that mean? That means that it's a virus that causes the human immune system, so the system that works to keep us healthy, it causes that system to stop working very well and stop working efficiently. And thus it makes us more susceptible to other viruses and infections. AIDS stands for Acquired Immunodeficiency Syndrome. This means that it's a syndrome as a result of having the HIV virus, and it compromises the immune system even further, making it even harder to fight off infections and viruses. The important thing to note about HIV/AIDS is that if this virus is left untreated, people can have some serious and life-threatening consequences as a result. For example, if someone not living with HIV gets pneumonia, their immune system is still strong enough to fight that off. However, if someone's living with HIV or AIDS, their immune system is so compromised trying to fight that virus that it won't be able to fight off if they get sick from pneumonia. But the great thing about living in the age that we do is that we have a lot of information about this virus, and people who are living with HIV, if they know their status early, they can live normal, happy, healthy lives. There are some amazing treatments for people living with HIV now. In fact, it's possible to get someone's viral load so low in the body that they can't transmit it to other people. The easy way to remember that is U equals U. Undetectable equals untransmittable. So if a person is on their HIV treatment, they won't be able to pass it to other people. Because HIV can be passed through 5 different fluids: vaginal, anal, and seminal fluids, as well as breast milk and blood. This is why it's so important to not share needles, especially when it comes to tattooing, piercing, or injecting drugs. Like most other STIs, HIV does not have symptoms. And so the only way to know 100% is to get tested and to know your status. Fortunately, testing for HIV is getting easier and easier. You can even do a quick finger prick, so it'll look kind of like when somebody does a diabetes test, and you can know results within 20 minutes. Or you could do a larger blood sample if you want to do other testing alongside it. They also have mouth swabs for HIV now. Especially if people are intimidated to go into clinic or they don't live close to a clinic, they can order away and take these tests at home. The important thing to remember about HIV is that it's avoidable, and if someone is living with HIV, it's treatable and they can live perfectly healthy lives. And also, condoms are great at preventing the spread of HIV because HIV can be spread through those fluids, the vaginal, seminal, and anal fluids, and using a condom or dental dam can help prevent the transmission of fluids. On to our last category, parasites. These are caused by tiny organisms living and feeding off of a host. The first one is pubic lice, otherwise known as crabs.
Lice! Mr. Krabs!
The important thing to remember about pubic lice is it's the only STI that will always have a symptom. This STI can be pretty hard to prevent with condoms because condoms don't always cover up the entire area where pubic hair grows, but it's tested with a visual examination and it's treated with some special shampoo. The last STI we're going to talk about today is trichomoniasis, otherwise known as trich. Trich is also normally asymptomatic, and it's tested with either a urine sample or a vaginal swab. The great thing about this parasite is you can get it out of your body, just with a round of antibiotics that will kill the parasite. But condoms work great to prevent the spread because trich is found in vaginal, anal, and seminal fluids. So I know that there are a lot of STIs, but there's also a lot of things we can do to help prevent the spread. Number one, and probably the most important thing if you're going to remember anything from this lesson, is if someone is sexually active, to get tested early and often. It's recommended to either get tested in between each new partner or about once a year. Number two, another great way to help prevent the spread of STIs is to limit the number of sexual partners. And number three, using condoms consistently and correctly. While there are many ways to cure, treat, and live with STIs, an STI diagnosis can really mess with someone's mental health. And so you can kind of think about preventing STIs as a way to protect your own mental health. And sharing this information with others is a way that they can help protect their own physical and mental health as well. So with that, let's stop for today. And our question of the day will be, what's something new you learned in this video? As always, leave the answer down below. All right, wise guys. See you in the next one. Wise Guys is a program of the Children's Home Society of North Carolina.